Trauma has become a little bit of a buzzword in recent times, and I'm seeing reference to trauma turn up more and more amongst holistic therapies and practices like yoga or breath work and meditation practices and somatic experiencing body work as well. And whilst there is a lot of really good evidence and we have really quite a good understanding now as to how these more holistic therapies can support people who might be suffering things like anxiety and stress and even just calming the nervous system, I feel that we need to be really quite respectful of the field of trauma. And that's because trauma is quite a complex and unique and individualistic field, in that trauma will present very differently for each individual, and no one practice will serve each person in the same way. The thing about trauma is that this is a ongoing dysregulation that the individual feels in their nervous system. It's not a once-off period of stress. It's quite often a very long-term chronic condition. And things like breath work and certain yoga poses and even meditation are just simply not appropriate. And that can leave the individual feeling triggered or really quite disappointed in the practice. So I feel that as practitioners working in various different holistic therapies and spaces, we need to be considerate of trauma. And if this is a field that we're interested in moving into, I think it's really important that we gain the appropriate training and the appropriate understanding of exactly what trauma is and how it turns up in the body, and what are the appropriate practices to use to support somebody who may be suffering trauma. If you're a trauma survivor and you have attended various holistic practices before in the hope of maybe finding something to help you and your symptoms, and you've walked away disappointed, I just want to reassure you that it may not necessarily have been the practice itself that you attended. And it certainly does not mean that trauma needs to be with you, that it's that you cannot move through it or you cannot release trauma adequately. You can certainly do that. It may simply have just meant that the service provider that you attended may not have been adequately trauma informed and may not have known how to support you as an individual. If you are interested in learning more about trauma-informed practices or how to support somebody who may have experienced trauma, maybe in your own therapy sessions, please reach out. I'm more than happy to share some of my own experiences and practice in this field.